If I have 20/20 vision, my eyes are fine and I cannot have glaucoma. This is not true. In fact, you can have glaucoma and still have 20/20 vision. But it doesn't necessarily mean if you have a high eye pressure, you must have glaucoma. We can have high eye pressure without glaucoma. In fact, that is a condition that we call glaucoma is one of the leading causes of blindness in the world. But most people are saying different things about glaucoma, most of which are not true. As an eye doctor, I feel the need to make this video to reveal the truth about the 7 most common myths about glaucoma. Number 4 and number 7 may really surprise you, so make sure you stay till the end. Myth number 1, glaucoma only affects elderly people. While it is true that the risk of having glaucoma increases as you age, but even babies can be born with glaucoma and call that congenital glaucoma. And as an eye doctor, I've seen so many young patients with glaucoma. And sadly, it even includes one of my friends. So that's why regular eye exam is so important. Myth number 2, if I don't have symptoms, I don't have glaucoma. This is not true. When glaucoma affects you, in the beginning, you won't have any symptoms. You'll find that you can see where your eyes are fine, even though it started affecting your eyes. And this is because glaucoma affects your side vision first, and it does so slowly that most people don't notice it. And unfortunately, by the time you notice it, the damage is already in there. This is why glaucoma is called the silent fever side. Myth number 3, glaucoma can be cured. I wish I could say this is true, but currently there is no cure for glaucoma. Any vision loss from glaucoma is permanent, which means we can't restore back the vision loss. However, the good news is currently there are more treatment options available, from eye drops to surgery, that can go a long way to preserve your usable vision and prevent blindness. Myth number 4, high eye pressure means I have glaucoma. While it is true that having a high eye pressure is a strong risk factor for glaucoma, but it doesn't necessarily mean if you have a high eye pressure, you must have glaucoma. We can have high eye pressure without glaucoma. In fact, that is a condition that we call ocular hypertension. And what you have to also know that you can have normal eye pressure and still have glaucoma, which is also another type of glaucoma that we call normal tension glaucoma. So literally what actually defines glaucoma is damage to the optic nerve at the back of your eyes and also loss of your sight vision. That's why in the clinic we ask patients to undergo different tests for glaucoma, not just eye pressure. Myth number 5, if I have 20/20 vision, my eyes are fine and I cannot have glaucoma. This is not true. In fact, you can have glaucoma and still have 20/20 vision. This is because 20/20 vision is a measure for your central vision, not your side vision. And glaucoma affects your side vision first before it can affect your central vision. That's why when it comes to identifying glaucoma, other tests for glaucoma like peripheral visual field test are so important. Myth number 6, if my eye pressure is okay, I can stop using glaucoma eye drops. Unfortunately, if you do that, there is a high chance that your eye pressure will rise again and make your vision worse. Glaucoma is somewhat like hypertension. It requires a lifelong treatment to maintain stable vision. So even if your eye pressure is normal, you can still continue using your eye drops, unless if for other reason your eye doctor said you can stop using them. Myth number 7, which is the last one, only people with a family history of glaucoma can have glaucoma. This is not true. Most people think none of my family has glaucoma, so I can never have glaucoma. While having a family history of glaucoma is a strong factor for having glaucoma, but it doesn't necessarily mean that if no one in your family has glaucoma, you cannot have glaucoma. You have to know that glaucoma can affect anyone at any given time. That's why I keep saying regular eye exam is so important, even once in a year, especially if you are 40 years and above. So these are the most common myths people say about glaucoma. If you know anyone and I didn't mention it in this video, please let me know in the comment section. And if you have any question as well, you can drop it in the comment section below. Otherwise, thank you so much for watching. I will see you in the next one.